Her Excellency the Vice President will officially launch this initiative on behalf of His Excellency the President on Saturday 25th July 2026 at Tikiti Zone, Kisenyi 3 Parish, Kampala Central Division, starting at 7 a.m. The Vice President will participate in inaugural cleaning activities together with other government leaders, religious and cultural leaders, and members of the general public. Unnecessary movements of persons and vehicles is strictly prohibited during the 3 hours of cleaning activities. Exemptions will only be made for genuine emergencies and essential vehicles such as ambulances, fire and rescue services, and security operations. I urge all motorists, businesses, and members of the general public to plan accordingly. For 3 hours, let Uganda stop and clean. I repeat, for 3 hours, let Uganda stop and clean. During this time, all businesses shall remain closed. I call upon leaders at all levels to lead by example and actively mobilize the population to participate. In particular, I direct the LOC 1, LOC 2, LOC 3 chairpersons, parish chiefs, and LOC 5 chairpersons to mobilize the population and identify critical areas for cleaning. The National Cleaning Days initiative does not replace our daily responsibility to maintain cleanliness in our homes and the whole environment. Rather, it provides a regular opportunity for collective action to address sanitation challenges and promote lasting behavior change. The success of this initiative requires coordination or coordinated action at all levels, guided by newly issued implementation guidelines. His Excellency the President will be the overall lead champion. I repeat, His Excellency the President will be the overall lead champion. The Office of the Prime Minister shall be or shall provide overall policy oversight, coordination, and strategic leadership. The Office of the President, particularly the RDCs, shall support political mobilization and compliance at all levels. The Minister of Health shall serve as the technical lead for sanitation guidance and monitoring public health outcomes. The Minister of ICT and National Guidance shall drive mass mobilization and public awareness through the media and digital platforms. The Minister of Local Government, together with local government leaders, shall coordinate community mobilization, identification of priority areas for cleaning, manage waste collection and disposal, and enforce sanitation bylaws within their respective jurisdictions. The Minister of Internal Affairs, the Uganda Police Force, working with other security agencies, will enforce adherence to this initiative strictly and consistently. Participating in the National Cleaning Days initiative is a civic responsibility and is not optional. Any person who fails to comply with lawful public health notices, creates or maintains a public nuisance, illegally dumps or improperly disposes of waste, or obstructs public health officials or any other authorized officer in the execution of their duties, violates the National Cleaning Days implementation guidelines without lawful exemption, shall be liable to enforcement action in accordance with the Public Health Act, the Local Government Act, the National Environment Act, applicable local government authority bylaws and ordinances and other relevant laws. Fellow Ugandans, a clean Uganda cannot be achieved by government alone. It requires commitment of every citizen. Let us embrace this initiative and make responsible waste management a lasting national culture. Together, let us build a cleaner, healthier, and more productive and prosperous Uganda for God and my country.
Basically, I would want to appeal to Ugandans to appreciate that this is for the good of all of us. When you visit our health facilities, I have been visiting hospitals of late, you find the hospitals are full of patients, both those occupying the beds, but also those on the floor.
Even those dying.
Of course, even those dying. And what is bringing these patients to the hospitals are largely illnesses.
Diarrhea,
respiratory infections, these non-communicable diseases like high blood pressure, diabetes, which if we intensified a campaign on how to avoid and prevent most of these illnesses, then we can get fewer patients and fewer people getting diseased. So Ugandans must appreciate that this campaign of cleaning our surroundings, our public spaces, our markets, our community spaces is meant to ensure that we have hygiene, cleanliness, orderliness in our society, and this will contribute significantly to reduction of most of the diseases which...
I also want you to talk about malaria, which is the most killer disease